Welcome to SG Health and Wellness Guest Series. Today's episode marks the third episode in our 5-episode series with Dr. Ajitabh Srivastava. Today's topic is the gallbladder and its related complications in the liver. A warm welcome. It's a privilege to have the opportunity to speak with you. Today's topic is gallbladder and its related complications in our liver. So, can you please tell us what is the role of gallbladder in the digestive system and how does it work in conjunction with the liver and bile production?
So, thank you for the opportunity to talk to you and through you to talk to the listeners on a very important topic, which is very commonly affects the common population. So, gallbladder is an organ which is there in our body and which is an extension of our biliary system. So to understand about it more is our liver. Liver is known to produce bile, or in Hindi it is known as pith. Okay, so this bile is secreted by the liver, and as if our viewers can see this, through the bile duct, it comes and drains into the first part of the intestine, which is the duodenum. Okay, gallbladder is just an extension to the bile duct. Okay, so if you see this diagram very closely, gallbladder is nowhere involved in the production of bile, which is a common thought which a general public has, that the bile which is produced by the gallbladder. Okay, gallbladder is just an extension. Whatever bile is produced, bile juices which are produced, which is helpful for the digestion of the food, mainly the fatty food, is produced by the liver. The bile ducts is just a channel for transporting the bile into the intestine. And gallbladder is just an extension on this. Okay, so to your question on about gallbladder, its location and function. So gallbladder is an organ which is located in the undersurface of the liver. It is just attached to the liver. It is not connected by any means to the liver. And through the cystic duct, the channel, the bile, what is produced in the bile duct, it gets onto the gallbladder, and from the gallbladder through the same cystic duct, it is drained into the bile duct. So the function of the gallbladder is, it is working like just an storage, not even storage, like it is just an organ which over the evolution has become redundant. Okay, it has not got any major role per se in the any of our body function. Okay, so just for a very minuscule function of the gallbladder is whatever bile is produced by the gallbladder, by the liver, which is there in the bile duct, part of it gets onto the gallbladder. And in the gallbladder, it gets concentrated, extra water gets absorbed, and a concentrated bile sits in the gallbladder. And whenever we take fat rich diet, so this gallbladder contracts, and this concentrated bile gets drained into the bile duct, which is further drained into the intestine and mixes with the food that we eat.
So, what are gallstones?
Okay.
And how it forms?
Okay. So the gallstones are basically concretions or the solidification which happens because of supersaturation of the bile. As I mentioned to you, the bile in the gallbladder gets concentrated. So after a certain point, this concentration becomes more and more thick, and then crystallization and stone formation happens. So the gallstones could be either cholesterol stones, which are white, patterned. They are in a very regular pattern. It is there, or it could be a biliary stone. Biliary stone, because of supersaturation of the bile, whatever thickness in the bile is there, it will first form sludge,
Mhm.
and that sludge will further solidify to form stone, and is a sort of a biliary stones, which is known as.
So, what are the risk factors associated with gallstones?
Yeah, the risk factor, which is not always the true, but a general mnemonic which is used for etiology or cause, or people who are mostly affected by the gallstone, is five. If it's four F's, is fatty, fertile, female, or 40. Okay. So this is a mnemonic which is generally used. Okay, which means it is seen in more obese people. Okay, people who are less than 50 years of age, fertile. Okay, female, it is common in female. And
Is it really?
yeah,
Is
yeah.
it really? Okay.
Okay, so it is just a mnemonic which is there. So just the common causes of, like say, it is seen in among the female population more than males, but not that males it is not there. But if we'll say the demographic changes between the female, it is more common among the females. It is seen more commonly in obese people. Obese people are known to have more cholesterols, and then there is high cholesterol content in the bile juice, and that is responsible for formation of gallstones. Then it is seen in, like say, one reason for it is the gallbladder. As I mentioned to you, it contracts. Okay, if there is some dyskinesia where the gallbladder doesn't empty adequately, so a part of the bile may always remain accumulated over there, and that also could be a risk factor of formation of the stones in the gallbladder. Yeah.
So, what are the early signs and symptoms?
Symptoms of it. See, in a large majority of patients, gallstones may lie asymptomatic. Okay, it could be just an incidental finding on the routine ultrasound. When a routine ultrasound is done, gallstones would be identified. Okay, but once the symptoms come in because of the stones in the gallbladder, that means it is a warning sign that the gallbladder needs to be taken out. Okay, so the symptoms which is most commonly seen is it could be either biliary colic. What do you mean by biliary colic? It is a person may complain of some discomfort and maybe a colicky type of pain which is intermittently coming. Intermittently, it will increase in intensity and it will go off. Okay, and that is there in the right upper abdomen. And the cause of it is, suppose the gallstones are there, the gallstone is trying to go past the cystic duct. Cystic duct is a narrow structure. So the gallstone will go and obliterate over here, the opening, the junction of it with the cystic duct. And then the gallbladder will try to contract under a closed system. So that will lead to something like a spasmodic pain, because some organ is trying to contract and there is an obstruction in the outflow. So that would be. So once the obstruction is relieved, the pain will also be relieved. Okay, so that is the first symptom. The second symptom of it could be continuous pain. Okay, what happens is that in those, the stone gets impacted. Once it gets impacted, there is a continuous pain which is there, and this bile which is there in the gallbladder will cause inflammation and infection of the gallbladder. Okay, which is known as calculus cholecystitis, like inflammation of the gallbladder. So a presentation of that would be a person would be having a regular continuous pain, and on touching, that pain will be really very severe. Okay, the tenderness would be there, and then after that, it may have, in addition to that, because as I mentioned, that it could be in a inflammation of the gallbladder. So fever may be a common presentation along with it. Patient may go into severe infection, sepsis. In a very small percentage of patients, there's gallbladder wall when there is a recurrent attack of cholecystitis, the wall becomes weak and this wall may rupture, and that can lead to localized peritonitis, or if it goes into the whole abdominal cavity, there can be a generalized peritonitis, there can be an abscess formation. So the presentation would be mainly the pain, fever. Sometimes it may not be the gallstones per se, but the stones, if it goes down and blocks the bile duct, then the passage of the bile from the liver into the intestine is obliterated. So a patient may present with jaundice, clinical jaundice, where there will be yellowness in the eye because of the stones going and blocking the bile duct and causing obstruction to the normal flow of the bile to the intestine.
Can you explain when surgical interventions are recommended?
Gallstones in a good number of patients, they may just be identified incidentally as a stone in the gallbladder. Okay, so the indication for the surgery of the gallbladder is whenever it is giving symptoms. The surgery, like the symptoms as I enumerated, whenever there is a pain or attack of calculus cholecystitis, or whenever there is anything which is even upper abdominal discomfort, like some dyspepsia may be there, where a person may complain of some indigestion and all, and the pain may be in the upper abdomen, and that dyspepsia may also be attributed to gallstones. And on the ultrasound, if we identify to have a gallstones, so mainly upper abdominal discomfort, pain, and when a gallstone is symptomatic, there is an indication to surgically remove the gallbladder. The surgery of the gallbladder is a very safe operation. Okay. There are a few patients who may say that I have gallstones, take my gallbladder out. Okay. Which may be okay in one manner. Okay. But if I talk about our literature suggests that just presence of gallbladder doesn't mean that a person needs a surgery for the gallbladder unless it is symptomatic. Okay, so and the surgery for the gallbladder is removal of the gallbladder, which is cholecystectomy. The surgery could is in a large majority of patients is done laparoscopically, where small incision is given in the abdominal wall, through which through the laparoscopic technique, the gallbladder is dissected out and the gallbladder is removed from the body. Since the gallbladder has got no major body function, it is, again I will say that it is a vestigial organ. So removal of the gallbladder is doesn't lead to any problems in the patient. Okay, gallbladder surgeries have been done now for almost a century. Okay, among the surgical specialities, gallbladder surgery was the commonest surgery which has been done now from centuries together. And it has been long follow up of the patient. And it is one thing which is very clear, that removal of the gallbladder doesn't affect the quality of life or the digestive process of an individual in any manner. Okay.
I experienced that. I know
Yes.
that.
Okay. You have experienced it. So yes, you will be
Yes.
the, because there are a lot of, I think,
No,
so
I was
myths,
not
and
obese that time.
so it is again, if it's just a mnemonic or a statement which is given, that it is seen most commonly. Any mnemonic which is made in this manner doesn't mean that it is there for
Correct.
everybody,
Exactly.
but it is. But yes, you will yourself be a advocate where, because at times people, I have seen lot of patients coming to me who will be suffering, and I've been telling them that take out the gallbladder, but they have their own apprehensions or worry or myths or wrong notion about that if I take my gallbladder out, it will lead to weakness in my digestive system. I won't be able to eat well. I won't be able to
Absolutely.
leave my. It is just a wrong ideas,
Exactly.
concepts which people have,
Exactly.
and they have to come out of this. Yes, presence of gallstone doesn't need a surgery, but if this gallstone is causing problem to the gallbladder, it is better to take it out because it has a potential of causing problems and complications. As I enumerated, that it can lead to something like gangrene of the gallbladder, perforation, it can cause severe sepsis. Some of the gallstones slipping down, causing obstructive jaundice, can even block the pancreatic duct, and that pancreatitis can be at times life threatening. So, to our listeners, if you have symptoms because of your gallbladder, better take it out. Meet a surgeon, get yourself evaluated, get yourself assessed whether surgery is safe on you, and get the surgery done.
Correct.
Okay, so the surgery for the gallbladder is doing it laparoscopically. It is a very safe surgery. The cuts which are there in the body is just small cuts, 4 cuts, one in the navel, one above, and 2 small cuts. Sometimes you can even do the surgery by 3 cuts. And then you dissect the gallbladder and take the gallbladder out from one of the small cut. So by second day of the surgery, majority of the patient are discharged on soft diet.
In my case, it was a 1 day morning and
Evening you were discharged. Yeah, many
Yes,
times
sir.
like
Just a
people
few hours, you
want
can
to
say. Yeah.
stay in the hospital for a day, so you keep them on the day of the surgery and next day you discharge them. And by say a week after the surgery, they should be up and about and should be able to resume all their duties.
Exactly.
Yes, for another week, I will say sometimes some heaviness or bloatiness may be there because it would take some time for the digestive system to adapt to something which is not there. Say it is seen that once the gallbladder is taken out, this storage function is taken care by the bile duct. Where in a normal person, the bile duct caliber would be around say 6 mm, 6 to 8 mm. A person on whom the gallbladder has been taken out, this caliber of the bile duct increases to around a centimeter to 1.2 centimeter, which is a normal caliber. Okay, it increases in size because the now what gallbladder was working like a capacitance, now the bile duct is working, and the same function will go on. That whenever there is a requirement of more bile, there will be contraction of the bile duct where the stored bile in the bile duct will drain into the intestine. Okay, so removal of the gallbladder in no manner affects the digestive system
And the
or
liver
the
function
quality
also.
in the
Life.
yeah, they are as normal as before. It is a very safe surgery, and yes, surgery may have in a very small percentage of patients have some complications, but if it is done in safe hands and if it is done safely and carefully, the risks of having a complication secondary to surgery is very low. At the same time, I think so it's important for me to tell what are the potential problems or the complications which may come in with the surgery. It could be mainly if the surgeon overzealously try to dissect in this area, there can be an injury to the bile duct. Okay, there can be some bleeding in the gallbladder bed or some blood vessels which is going to the gallbladder. You apply a clip, that clip may slip and there can be bleeding. Okay, so these are broadly the complications and hence the reason. Okay, although it is a very small percentage of complication in a very small percentage of patients, but since every intervention carries some risks of complication,
Correct.
and hence the reason not that all the patients who have gallstones go in for a surgery. Okay, see if it is asymptomatic, although it is a very safe surgery, but there is a small potential that it can cause a problem. Okay, so and hence the reason the surgery is recommended only for those people who have symptoms because of their gallstones.
Are there dietary or lifestyle change individual can make to reduce the risk of gallstone?
Yes, gallstones, I think so. It is if a person is like for any other disease, having a healthy lifestyle, okay, has some role in decreasing the incidence of gallstones. Okay, so when I say healthy lifestyle, it means healthy, balanced, nutritious diet, keeping a watch on an individual's weight, okay, not to be too heavy or too weight has to be under check. Regular exercise, which will again keep a watch on the overall weight and sugars and cholesterol. So this coming down on it, because these are the factors which are high risk for developing gallstones, like a person who is obese or fat, who's diabetic, okay,
In
and
my case, it was diabetes.
yeah, and that if you take care of all those risk factors, the incidence of gallstones would be lesser.
Thank you, Dr. Srivastava, for sharing your valuable expertise and experience on gallbladder, liver, and or relationship. Thank you for your time and expertise. And it's been literally a privilege of having you on our show.
Thank you. Thank you very much for inviting me. I think so. It's a very pertinent topic, and I think so through this discussion, I hope the viewers will have an idea. If they have symptoms, they need to get themselves operated before this gallstones can create more problems. They can come and see a doctor, a surgeon who deals with it's a surgical procedure which is done commonly by most of the surgeon, and they need to meet their doctor as early as possible.
We look forward to our future
Yes,
discussion.
yes, sure.
Thank you so much. Thank you. And take care of yourself until the next time.